Good day, everyone. Thank you for joining us for this video update. The reports from across the country indicate that home care and hospice is staying strong during these challenging pandemic times. Your ability to deliver care has many barriers, but you are relying upon your creativity, ingenuity, innovation, passion, and drive to meet those challenges. We're trying to do our best here at NAC to help you as these times continue to evolve. Count on us to be there for you. The first update, NAC. We are 100% operational. We are 100% remote in terms of our operation. We are all connected all across the metropolitan DC region and even beyond into some other states where staff are located. So count on us to be there as if our offices were fully open in Capitol Hill. Beyond that, I want to bring you up to date on a few other NAC-related matters. First, definitely recommend you take a look at our COVID-19 website. It is full of tremendous information, up-to-date information on clinical practice, policy issues, as well as the guidance coming from CDC and NIH and others on how to cope with infection control. Absolutely a tremendous resource for you. In addition, this week we will have our first in a series of town halls that include experts coming from across the country to help you deal with the challenges of today. We're going to rely a lot on the NAC Board of Directors who themselves are on the front line. An upcoming Wednesday program will focus from Evergreen Health out in Seattle, Washington, the epicenter of the COVID pandemic. So definitely tune into that. It'll be at 1 o'clock every Wednesday for the next multiple weeks until we get ourselves through this. And finally, to mention to you that we are still working on non-COVID issues, and we know you still need our help on that. So we will be continuing our series that we had of education regarding PDGM. We will have a series of live webinars, full day webinars on PDGM towards the end of the month of April. That information will be getting out shortly. And I want to assure you, we are working very hard to try to find ways to deal with the PPE shortages. I wish we could say we have an immediate solution available, but supplies are drying up. FEMA is allocating them on a state-by-state basis, and everybody is standing in line. So you need to have your voices heard on the local level in order to get the proper protective equipment for your staff. That's where the decisions have shifted. Now, with respect to Congress, a lot going on that you really would like to know, I'm sure. First, Congress and the Senate side is debating a bill of nearly $2 trillion to provide relief to workers, to businesses, and in particular relief in healthcare. Issue at the top that affects workers and businesses at large is the expansion of sick leave and family leave opportunities. Phase 1 of that legislation passed last week. Further work on it is going on this week, and the Department of Labor is now dealing with a particular facet of it that is important to you. Within these laws is an exemption for healthcare workers, but no definition on healthcare workers. The purpose of the exemption is to make healthcare workers available to provide healthcare to the growing need for those services all across the country, not to be unfair to those workers. They know that there's tremendous respect for those workers in all capacities. NAC has weighed in on this with the Department of Labor, seeking a definition of healthcare workers that encompasses all of the types of disciplines that provide care within home care, home health services, and hospices. Stay tuned on this. It is evolving very quickly. We would expect to see the Department of Labor issue guidance in the very near term. On the Medicare front, the Senate bill contains a number of pieces of relief for both home health agencies and hospices. On the home health front, it would provide authority for non-physician practitioners to order and certify care. Our long-standing bill on nurse practitioners and physician's assistants may actually become law. In addition, there is support for telehealth services in the home, both through physicians, other practitioners, and through home health agencies. A lot more to develop around that. On the hospice side, the Senate bill will allow for physicians to do telehealth visits to meet the face-to-face requirement. That's a standard already available under the Medicare home health benefit because of some differences in the language of the law. In terms of regulatory action, CMS is trying to juggle tremendous challenges, picking out priorities for all of the sectors of healthcare, trying basically to follow a philosophy of reducing red tape so that they could continue to have access to care and to keep the dollars flowing to the providers of healthcare services. In line with that, CMS has issued guidance already allowing physicians in the home health benefit to do face-to-face telehealth encounters. In addition, we have seen changes regarding submission of data under OASIS, cost reporting, and quality data. There's much, much more to come. We have been in regular contact with the CMS administrator, Seema Verma, and all of her staff in trying to move these things forward. For home health, there's quite a bit more on the agenda. Today's the day, hopefully not pushed tomorrow, but at the Office of Management and Budget is a very important regulation providing for some emergency relief, and we understand that within that regulation is relief regarding the home health homebound requirements as well as telehealth in terms of being able to get reimbursed for those services. We want to be optimistic, but we want to be cautious about that too. We've had a bit of disappointment so far regarding the progress of both of those issues, but we are very hopeful to see something positive today or tomorrow. And quite a few more items on the agenda that CMS is considering. Amongst the priorities would include allowing relaxation regarding the requirement for physician-signed orders prior to billing. We've requested the suspension of the behavioral adjustment relative to payment rates to increase rates by 3.46%. We've asked for the restoration of the full WRAP payment and the suspension of a number of program integrity measures like TPE and the Review Choice Demonstration Program, along with a joint request regarding aid supervision requirements for both home health and hospice services, where the nurse is required to do an in-person visit every 14 days. So you need to stay in touch with this. You need to help us understand what barriers are out there that we should be working towards, but also recognize that CMS is taking this on a step-by-step, priority-by-priority basis. We need to have a little bit of patience here. Our voice is being heard. We are being listened to, and we are having direct conversations with the powers that be at CMS. So I want to thank you all for what you've been doing. I want to thank you, for all of the people that you're caring for. I want to promise you, we are committed to being there with you every step of the way. We need you to help us. We need you to let us know what the priorities are, what your suggestions are, what new ideas that you have. We are fully available by email and by phone, so do not hesitate to connect with us and help us help you. So thank you, appreciate your time, and we'll be doing further video updates in the near future. Take care now.